fibrous dysplasia and McCune-Albright syndrome. FDMAS in short, a rare, non-hereditary condition involving your bones and possibly your hormonal glands. In fibrous dysplasia, healthy bone is replaced by soft fibrous tissue. This weakens the bone and increases the risk of fractures. In McCune-Albright syndrome, your hormonal glands produce too much hormones. The symptoms of FDMAS can differ per patient. Also, your symptoms might change when you grow older. Patients might present with bone pain, fractures, or deformities. In McCune-Albright syndrome, they can present with hormonal overproduction, causing early puberty or growth, or thyroid hormone excess. Since FDMAS is rare, not many doctors are familiar with the disease, and your diagnosis might be delayed. Increasing awareness helps. The International Consortium for Fibrous Dysplasia and McCune-Albright syndrome connects researchers, doctors, and patient associations from all over the world. Fibrous dysplasia and McCune-Albright syndrome is a part of you, but does not have to define your life.
Good morning or good afternoon. My name is Adrienne McBride. I'm the Executive Director for the FDMAS Alliance in the United States and a key board member for the International Consortium for FDMAS. And I'm pleased to be here today. I would like to begin by introducing Dr. Natasha Appelman. Dr. Natasha Appelman is an internist endocrinologist from Leiden University Medical Center, LUMC, in the Netherlands. She has worked at the LUMC since 2012, where she specializes in bone and mineral conditions. Natasha leads the LUMC multidisciplinary FDMAS team and has published many studies with her teams on FDMAS. Natasha is also the lead for the European Registry for Rare Bone and Mineral Conditions, which develops special disease-specific module for FDMAS to collect clinical and patient-reported outcomes. And this module is expected to launch in 2022. She serves as the medical and scientific board. She serves on the medical and scientific board of the Dutch FDMAS Patient Association and has from the start. I'd like to start with a few questions, if that would be okay. Can you give a brief overview and history of the International Consortium for FDMAS for somebody who's never heard of the organization? Like, for example, when did it start? And can you speak to the journey?
Yes, thank you very much, Adrienne, also for this kind introduction. So the consortium started, well, there is not a really official start, but it all started when in 2015, there was the first official meeting was held in Oxford by Professor Kassim Javed, who invited researchers, clinicians, and also patient associations from all over Europe and also from the United States. And after this first meeting, it was concluded not only the interaction was very good, but also that everyone felt the necessity to develop some sort of guidelines, because as you know, there are no official guidelines for FDMAS. And one of the things that came forward during that meeting is that a lot of patients get different types of care depending on the country, or even within the country, depending on the physician you are seeing. So that was one of the main key focus points in the beginning. So not that much putting together a lot of research, but basically the first start of the consortium was really to make the care better for patients with FDMAS. So after that first meeting, we had a couple of telephone calls during that time. And then we had in 2017, we had a meeting in Leiden. And we also had a meeting in Lyon by Professor Roland Chapelat. And on that, all that meetings had the same start. The start was always we would like to talk about our education activities, but also about our research. But we always went back to trying to define the guidelines, and in the end, that resulted into the care pathway as it's designed today. So I think in 2015, we might say that that was the real beginning of the journey of the consortium. And afterwards, we tried to finalize the consortium and make it more official, also with our mission statement, and to set certain goals, also to make sure that everything can continue in the future. Because as we noticed, of course, also during the COVID period, it has been more difficult to reach out to each other, where there are some consortium members who haven't seen each other for more than 2 years. But by every time we go coming back together, I think that really helps also for the future plans for the consortium.
So can you speak to the organizations? You mentioned some of the accomplishments. What are some of the aspirations of the International Consortium? Where do you go away?
I think there are many aspirations, also depending on whom you ask it to, of course. So one of the important things, I think, is that we published the guidelines in 2019. So that will be something on our agenda in the next 2 or 3 years to do a revision of the guidelines, because after that publication, a lot of new information has come forward. So there is a need for an update of the guidelines. One of the other things that we have notice while getting the consortium going is that every time we had the consortium meeting in a different country, more patients and more patient associations came to those meetings. So I think one of the other good things is for the consortium, and one of the goals for the consortium is getting patients to connect with each other, but also to connect them with a proper expert in their own country, or perhaps even outside their country. So I do think that's still a very important goal for the consortium. And the other point is, I think, while FDMAS is being treated by so many physicians, I think it's really important that we also try to focus to get some sort of educational program, or make sure that a lot of the different scientific societies have these webinar series which came up during COVID. And I'm sure that they will continue those webinar series for professionals. I think it's also very important that we try to make sure that FDMAS has a specific spot on those webinar series when they talk about rare bone and mineral conditions, that this particular item should be included as well.
So going back to the International Consortium, the International Consortium is the organization of FDMAS patient organizations and research. Why is this collaboration so necessary? And how can organizations join?
So I think collaborating is very important on every topic. So for instance, I cannot treat my patients properly if I do not collaborate with my orthopedic surgeons, or even surgeons from outside my hospital. And I think the same goes for research. I think one of the greatest achievements of the consortium is that already before we were launched officially, that we already had some mutual collaborative publications. It allowed us, for instance, to have a further look into the fracture risk of patients with FDMAS together with the NIH. It allowed us to identify the small but increased risk for breast cancer in FDMAS together with the colleagues also from the NIH. And we had another further look into Massabro syndrome with the NIH together, but also with Professor Appelman from Lyon. So already in the research part, in the research field, it's very obvious where you can gain, of course, because FDMAS is a rare disease, so the numbers are small, and also the physicians who are treating the patients or doing research with the patients, they also do have low numbers, and sometimes to see certain items and to make a good connection between the different symptoms of the disease, you have to enlarge your patient population. But the same goes also for care for patients with FDMAS. Because when you've seen a complication of a certain treatment, or if you've seen a certain symptom more often, it's more easier as a physician to diagnose it and to treat it. And I also do think that connecting for physicians, when you know each other, it's more easily to pick up the phone and call that colleague who you know treats a lot of these patients, or has seen that certain type of symptom of that outing of the disease before. So for professionals, I think it's very clear why you only have advantages of joining a consortium when you see patients with FDMAS and are interested in disease. For patients and for patients associations, I think they can benefit from each other and they can benefit from products that are already being developed by certain associations. So, for instance, the movie that you just saw from on FDMAS was a movie that was originally designed for the Dutch FD Foundation, and we deliberately kept it very general. And that way, you can use a different subtitle, a different voice. And then you can already use that same movie in another language, and thus also in another country, because not all countries will have the same availabilities for funding for patient associations. So I think these are the small things that are already really important. Also, it allowed us also to, for instance, translate the patient checklist in the care pathway in many different languages, and also really have the patient's view on that. So I think there are many advantages. And how can you join? Well, joining is really quite easy at the moment. You just have to send an email to the info@icfdmas.com, and then we will put you on the mailing list, and we'll make sure that whenever there's a newsletter or a meeting planned on FDMAS, you will get in the loop, and then you can always choose to join or not.
So you just answered my last question. So for people to learn more, they should just go to ICFDMAS.com and visit the website.
Yeah, so on the website, we have very different items there, a short explanation about the journey and also about the consortium. There is a link to the care pathway and also a link to the patient checklist. So also for patients, it's interesting to go to the website. We have a list of the publications that were being produced with collaboration with some of the consortium members. And of course, when there's something new or you want to contact us, you can also find it there.
Perfect. Are there any questions? Let me look in the chat box here. Some of the people watching are lone patients without a patient organization in their countries. Do you have any advice or suggestions for these people who are feeling especially isolated or struggling to find medical care?
Yeah, so we've deliberately also put on the website of the different patient associations there. So what we could do is also to bring them in contact with somebody who speaks the same language, because not all patients will speak English, not all patients will of course speak Dutch. So we will try to figure something out who we can connect you with. And it's also possible for these patients to join the patient days that we are trying to organize with the FDMAS consortium. So for instance, when we're had the meeting in Florence, the last meeting, there was also somebody there alone, a father of a child with FDMAS from a country which did not have a patient association. So it's always possible to join in, and if necessary, we can always connect you to a different patient association to get the info you need. And if needed, it's also even possible to get some advice from one of the medical experts.
I'm seeing if there are any other questions. Oh, there's some medical questions. I'm going to defer these to you. How fast can FD in the spine bone grow in a period of 6 months?
Yeah, it really depends. So answering medical questions without actually speaking with the patient and knowing all of your medical history is very, very difficult. So I'm sorry, I'm not going to answer it, because there are so many items that it can depend on the age, on any other comorbidity, on growth hormone or thyroid problems. Are you using any kind of particular medication like bisphosphonates or anything else? So there are really a lot of influencing factors. So it's very hard to answer that. I'm sorry.
That speaks to the complexity of the disease.
Yeah, of course. Yeah.
Are there any other questions? Well, we're seeing people are tuning in from the Philippines. Can everybody put in their the chat box where you're tuning in from, so we can see what our reach is? sweetie.
In the meantime, I think it's also very important to realize is that the only reason that this consortium has become a success, I think we mainly owe it as professionals to the patient associations. I think if the patient associations were not that active to try to chase us, to get the meetings planned, to get the terms of reference be written down, and even also to help with the legal part, because the legal work for the consortium was done by the Patient Association in the UK. I think it would have been very, very difficult to make this such an easy start with a beautiful website with everything there. So I think this is a great example on how patient associations and also patient empowerment can really help with setting up these things and get things going. And I think that's one of them, because I do work a lot with patients and also with different diseases, but I think that's one of the most remarkable things I always keep seeing with FDMAS is that the patients are so connected and so eager and willing to help. I think that is really something to be proud of as a patient association.
Yeah, I agree that the patients are going to move the needle forward on finding treatments and cures. We're seeing people from the UK, US, Texas, Algeria, the Netherlands, Southeast England, Germany, Lancaster, Pennsylvania, and Spain watching this webcast.
Yeah, so that's great. I think it's a really great outreach, and also something that I do think when a professional organization would have done this from the doctor's side on, I don't think you would have had that outreach. I think in that sort of terms, patients and the patient associations have a much broader outreach than the physician's point of view. And I'm also really curious is that one of the things that, of course, FDMAS Alliance have been very active, also with the persuasion of the care pathway and also in the setting up of the consortium. You just heard my side, of course, and I would like to know a bit more about the side from the patient associations. How did you experience that?
Are you asking me from the FDMAS Alliance Association?
Yeah.
So I am standing on the shoulders of my predecessor and our scientific advisory council, who have been working since 2015, growing the International Consortium and helping that collaboration. I've been with FDMAS Alliance now for 2.5 years, and I realize, how important it is for me to represent what the patient voice wants and how important collaboration is for all the reasons that you've stated. And we are more excited and more hopeful that treatments and development of treatments and eventually a cure would be on the rise. We're looking forward to 2023. We're looking forward to having a patient conference and bringing together researchers from all over the world. And the International Consortium is going to be a big part of that. I just see another question coming through, and I think that this is more for you. It says here, why do doctors always want to give lidocaine and cortisone injections? I'm so tired of looking for pain relief in my bone pain, but frustrated because that's all my doctors offer. I started my menses when I was born, and I'm now 70 years old.
Yeah, so also that's a question that I can give an answer to in general. So in general, when you give cortisone or lidocaine injections, it usually often treats only treats locally when you inject it, and it also depends on how it's being injected. So quite often the combination of lidocaine and cortisone is being given for something that also gives local inflammation, like local inflammation or irritation of the muscle, or where the muscle attaches to the bone. So I'm not quite sure if the lidocaine and cortisone truly are giving inside the bone, because it will not relieve the bone pain that much at that particular site. It really does something for your soft tissues over there, but not for the bone. So perhaps there might be some other possibilities as well. We always try to look at the pain that is being experienced by FDMAS patients in multiple ways, because some sort of the pains are more being caused by neuropathic pain. So that means that the nerves are being irritated, and then a lot of the normal painkillers and also lidocaine injections or cortisone injection will not help that much. And you have to switch to another kind of pain medication to treat neuropathic pain. Sometimes there can, of course, be pain due to small stress fractures or small impending fractures. And then, of course, that will heal in time, or you might require surgery. Other sort of pain, we think it's related to the bone activity over there. So those are, for instance, also reasons to start patients on bisphosphonate treatment or other drugs to make sure that the bone activity goes down. So there are very different ways or looking at pain in an FDMAS patient. And of course, due to deformations or due to, especially at the age of 70, you might also experience some secondary osteoarthritis. So due to the fact that the bone is deforming and really located near a joint, it might also be that that joint is becoming a bit more deformed, and therefore it wears off more quickly, and you get osteoarthritis. So that also might be another cause of the pain. So I think there are many ways to look at it. So it's also an answer that I cannot provide to you personally with an advice to you, but we can give some general advices that there might be other ways to approach it.
So would that be in the patient guidelines?
Yeah, so one of the things is also in the patient guidelines, we have a flow chart on how to act on pain, and also some certain advices that we give. So when to start, for instance, bisphosphonates, when to make sure that there's no pending fracture. So there are some clear advices over there how to look at pain in a patient with FDMAS.
So to reiterate, people or patients should print out the patient guidelines and bring them to their doctors.
Yeah, or at least check the patient checklist, because I think it's a very clear checklist that will guide you a bit through the consultation with your doctor, especially when you first had the diagnosis. I do know from experience that patients sometimes, of course, well, they perhaps do not feel comfortable of asking your doctor all those questions. But I think nowadays it's really important, and it only shows I'd rather have a patient who is well prepared and ask me thousands of questions that I need to answer them than a patient who has the feeling that they cannot relate to their doctor or cannot tell their doctor anything they would like to have on their disease, because the patient is the one with the complaints. And we have to make sure that, of course, the complaints are going away or improve, but also we have to make sure that quality of life and the patient goals are still kept alive during the treatment of the patient.
We have another question in the box. Does FD always grow back after surgery?
Yeah, so depends. There's a variety in different surgical techniques. So for instance, when you just scrape it out, it will definitely grow back. So scraping is not something that we would advise. If you, of course, take out a full bone and make sure that you that you are in healthy bone when you take it out, then of course, when you take out all the cells, then it will not grow back. But quite often that will be very, very difficult and only possible in very small lesions. And in very small lesions, you will have to ask yourself, well, why am I getting the surgery? Because FDMAS is a benign disease, so we do not offer surgery just to remove it, because that often can cause more problems and more pain, mostly post-operative pain, but also decrease of function of the area that has been treated. So I think when we do surgery, we never do surgery to take the FD fully away, because it's very difficult and you have to really ask yourself, why would you do that? And if you do a smaller surgery, yes, you have a higher incidence of the FD lesion growing back, especially when you're younger, because we also do know that FD lesions are more active while people are younger, and they tend to stabilize while aging.
I just want everybody to know that we're going to be posting the patient guidelines immediately after this Facebook Live, and we can share all these important links with you. So I really want to thank you, Natasha, for taking your time this evening, or this morning in my case, for sharing your knowledge, and I'm really excited about the International Consortium for FDMAS. I'm looking forward to 2023. Is there anything that you're looking forward to in 2023?
Yeah, I hope we will get the meeting for the FDMAS Consortium in Bethesda, or at least in the US this year, because it was planned to go in the US during the COVID pandemic, so it was not possible. So we're really looking forward to meeting everybody again, because especially we have not seen our colleagues from the US for a very long time. Yeah, only online, of course, but it's still different.
It's so true. Do you have any parting notes or anything that you want to end on?
No, I'm just very happy and very grateful that the consortium has been launched, and I'm quite sure it will be a great success. And I hope, and I would like to emphasize that this would not have been possible without the additional support of the Patients Association. So we're really grateful for that.
Yeah. Well, I just want to add to that I'm hopeful the lessons that we've learned in the last few years in the development of the vaccine for COVID, that we can, as an international consortium, work together to push the needles to finding more treatments and cures for FDMAS. And I just want to thank everybody who tuned in today, especially to you, Natasha. And I just want to give a shout out to our director, the FDMAS Director of Community Engagement, Tova Bernstein, and Martine. I don't know how to say her last name.
Martina Decker.
Yeah, who have done so much heavy lifting to make sure that we are doing our utmost for the FDMAS community. I'd like to also mention that this is the beginning of Global Awareness Week, and to please join us on Thursday, February 24th, 7:30 p.m. Eastern Standard Time for a film screening and community discussion. We're going to have Mr. Richard Pace, and he's going to show a little film about his triumphs over FDMAS, and it's called Pacing the Pool. So please register for that. And is there anything else that we have? Just big thank you to everybody again for taking your time, and follow our social media, our collective social media. Share all you can about FDMAS, and it's going to be good. There's a lot of hope. Thank you.